Hello, I'm Dr. Mark Dailey, and I want to thank you for taking a moment to watch this video. In our health recovery program, one thing we commonly see in patients is yeast and fungal overgrowth. Some of you have already gotten test results that confirm that you do in fact have yeast overgrowth. Some maybe not, but this information will be very useful to you and the people that you love. It's by no means a condition that is exclusive to women either. Many of our advanced metabolic tests have the potential to reveal yeast overgrowth. Millions of people are currently fighting a battle against a single cell fungus they can't see. This fungus belongs to a family of yeast called Candida albicans, and under normal circumstances it's a harmless part of your skin, intestines, and for women, your vagina. But Candida cells develop rapidly, and if your system is out of balance from eating unhealthy foods, taking certain prescription drugs, fighting an illness, and more, Candida can quickly grow out of control. The result is an astounding array of health problems that can rob you of energy and interfere with your ability to enjoy life. What's worse, most conventional doctors don't recognize the symptoms of Candida overgrowth and are literally clueless about how to cure it. Because Candida overgrowth or candidiasis is often overlooked by physicians, it's difficult to say exactly how many people may be affected, but estimates suggest that up to 80 million Americans may suffer from yeast-related problems, and 70% of them are women. Some common conditions that indicate you may have Candida overgrowth include irritable bowel syndrome, food allergies, migraines, asthma, chronic fatigue, fibromyalgia, PMS, cancer, weight gain, and depression. As you can see, the list is long and varied, and symptoms mimic those caused by many other diseases. This is a very important topic for many women, as up to 75% of all women will experience a yeast infection at some point in their lives. I believe one of the most important reasons is the overconsumption of processed foods and foods that are real high in sugar, both of which serve as fertilizer for the growth of yeast and fungi in your body. Oral contraceptives are also a factor, as these synthetic hormones create an environment that is conducive to yeast overgrowth. Last but not least, overuse of antibiotics, which kill off both good and bad bacteria and promote the growth of fungi and yeast. It contributes to making this such a common health problem. When we're talking about Candida, it's important to realize that vaginal yeast infections are not the sole health problem that can ensue. In fact, chronic fatigue is perhaps one of the most common ailments rooted in yeast and fungal overgrowth. Yeast may even be a causative factor in cancer. So, how do you know if Candida is to blame for the symptoms you're suffering? Well, often you don't know for sure, unless of course you've done some of the advanced testing. And that's why so many people suffer needlessly, because their doctors aren't having them do these advanced tests. Now, if you're suffering from some of the symptoms we mentioned earlier and nothing else seems to work, Candida is possibly involved. However, a good sign that Candida is taking hold of your body is feeling run down and developing a craving for sugars and carbohydrates, as this is the main fuel for the growing amounts of yeast in your body. The more sugar and grains you eat, the more the yeast grows out of control. Eventually, this will weaken your immune system and in turn can allow yeast to infiltrate various other organs, and the sicker you'll become. In order to prevent yeast overgrowth, you need to create an environment that makes it more difficult for the fungus to thrive. Typically, you can do this by making the following lifestyle changes. Number one, eat the best diet for you and exercise. A diet rich in meats, chicken, eggs, seeds, nuts, vegetables, and healthy oils free range and organic when possible, while avoiding sugars and carbohydrate-rich foods will restrict the amount of fuel that yeast in your intestines has available. And ideally, you should make your diet in tune with your nutritional type. Some people do better on specific diets. Number two, get plenty of good bacteria. You'll want to increase your probiotic or your good bacterial intake with a high quality probiotic supplement. Number three, avoid exposure to chemicals and medications. Antibiotics, corticosteroids, and birth control pills all need to be avoided. Paints, household cleaners, perfumes, and scents may also cause allergic reactions, and chemical sensitivities are real common in people with yeast overgrowth. Then four, address emotional and psychological issues. Food cravings, especially those for sweets, often are exacerbated by emotional dependencies. Because yeast multiplies so quickly, it's necessary to restrict not only sugar and refined carbohydrates in your diet, but also yeast and mold-containing foods. That would include alcohol, vinegar, and vinegar-containing foods like mustard and salad dressing, bread, carrots, potatoes, and beets because they're high-sugar vegetables. Fruits are important to avoid if you have this problem, as the sugar in the fruit typically worsens those who are suffering with yeast infections. Fruits can be resumed once the yeast is under control. Peanuts and corn, which often contain mold. Mushrooms, which are themselves a fungus. And aged cheeses. Also remember that the number one source of calories in America is not regular table sugar, but high fructose corn syrup, which is included in most all processed foods and should be avoided completely if possible. Now, if you're already facing candida, I highly recommend working with someone like myself, who's a healthcare practitioner who specializes in treating yeast overgrowth, to help you get through the treatment protocols. For you, this is something that no doubt we've already started, but keep all this information in mind as we move towards optimal health. Remember, better days are ahead. You're educating yourselves so you can educate your families, so you could take the information and practically apply it in your life. Thanks so much for your time and your attention. God bless and have a great day.